Good morning and welcome to Long Island Viewpoint. I'm Ken Rosato. This morning we bring you some new guidelines on what are some of the medications that might be appropriate for the elderly. We will also have with us folks from the Nassau County Firefighters Museum and Education Center. But first, heart disease. It is not only America's #1 killer, it is America's most costly disease. The American Heart Association estimates direct and indirect costs related to heart disease will total more than $480 billion this year. That same group also predicts that by 2030, heart disease will cost the nation a staggering $1.1 trillion, that is trillion with a T, dollars annually. Joining us in the studio, Dr. Joseph Tartaglia, a cardiologist practicing in White Plains, and Marie Cooper, who has had heart problems for years and received a new kind of treatment called EECP. Thank you both for coming here today, and we have to ask you, Doctor, what is EECP?
EECP. Well, EECP, it's amazing. It's been available in the United States for 15 years, and a lot of people still don't know what it is. But basically, it's a treatment for angina or heart disease, and it works by pumping the blood in the body, accelerating it back to the heart, and basically bathing the blood to all the organs in the body, especially the heart. So the timing of this pulsation is done in conjunction with the heartbeat.
And it's enhanced external counterpulsation therapy. Not that I know it, I'm reading it off a card. So it's a device that, what is it, an external device or is it an internal?
It's an external pump. Basically, it's attached to the patient on the legs, on the thighs, and the buttocks. And by timing it to the electrocardiogram, a pulse of blood is sent backwards through the body, back to the heart.
We're looking at a diagram of it right now. Is this the same thing that former Vice President Dick Cheney had before he had his transplant?
No, he did not. He had an internal pump. He basically had an assist device for the heart. Now, this is an external pump. This actually assists the heart externally without having to go into the body. It's completely non-invasive. And basically, it brings the blood to the heart and basically bathes the coronary arteries in blood flow. And over time, this makes them enlarge and grow collateral channels and create what we call natural bypass.
So is it, it's a unit, it's a device, it's not something that just squeezes the legs and I mean, it's not like what you would get, say, if you were recovering on a hospital bed? And
No, it's not one of those devices which is for venous flow. This is for arterial flow, so the pressure's a lot higher. And the timing has to be about a third of a second, so the equipment has to be able to launch that blood flow really quickly back while the heart's resting.
All right. And so I see these are patients right here, I guess, in a hospital.
Right, here's the treatment. This is how it's done. And you see that it's very comfortable. The patient doesn't feel any pain. It's done as an outpatient procedure. And they actually don't mind it at all. They feel almost nothing during the treatment.
Well, let's see if that's the case or if you're lying through your teeth. Marie, how do you feel when you have this done, and how is the result?
Oh, the result is staggering. I mean, I had 4 angioplasties, none of which were successful.
Okay.
And finally, at the time, told the present cardiologist that I had at that time, I got to come up with something better than this because it's not working.
An angioplasty being a stent, right? That's where they stick a little tube inside the tiny arteries inside the heart to provide better blood flow in the heart because you were feeling pain.
And that was after bypass surgery.
Wow.
I had the bypass surgery first, 4 angioplasties after that, and I'm still left with now what? Because it wasn't working.
My goodness.
And the cardiologist at the time put me on the most medication that I could handle, but said, you're probably going to go out with a massive heart attack.
Oh, man.
And how many years ago was that?
Oh, that was back in '95.
Is that cardiologist still alive, by the way?
He's still alive. But I said, let's come up with something better than this. And he couldn't come up with something better than this. He didn't know anything about EECP. And I was talking around, and someone happened to mention it to me, and the friend of mine went online and found that information, and that brought me to Dr. Tartaglia.
You're a living saint.
That's right, my living saint, and I've had it twice at that time, and then subsequent, a couple of years ago,
She's only had 2 treatments. Both took about 7 weeks in that whole period of time since then. And when I found her, she couldn't even walk across the room. Yeah. She was in such crippling pain and angina. And after we finished with her, she was a miracle. She's now doing marathon walking.
Yeah.
So I'm just amazed by this. So, I mean, you could take a person who is borderline candidate, you'd say, for like heart transplant even?
Yeah, we can. Yeah. Actually, it's only been approved for patients who have failed angioplasty, bypass surgery, and our maximum medical treatment and still have symptoms. It's only proof for that patient population.
Why isn't this being shouted from mountaintops?
Well, mostly I think it's because it's to the investment of many cardiologists, especially those that cut, surgeons, not to deal with this because it cuts off their resources.
Well, I think there's still a little bit of disbelief. A lot of physicians feel, how can something so simple work? And I think this is suspended disbelief. But we have a lot of data now. A lot of studies have been done showing that it does everything good for the heart. You've heard of hardening the arteries?
Sure.
Well, this softens the arteries. The function of the blood, the vessels works better. The endothelial, the little cells that line the vessels function
that's
better.
in your cheeks. So the same types of cells in your cheeks that are in the...
Right, that smooth lining inside the vessels. That really controls the size of the vessels. And also it develops little tiny channels. It grows new blood vessels. As a matter of fact, one of the research things I'm doing now at New York Medical College with Carl Hamby is we're actually showing that in the patients who improve, the stem cells, the precursors for the blood vessels, grow in their bodies. They increase. So we're naturally improving their own stem cell population, causing them to repair the patient's blood vessels. And these patients, if you follow them, we follow them out to 5 years, have less, the ones who have this improvement in stem cells, they have much less risk heart attacks, strokes, or major adverse cardiac events after 5 years.
That is just an amazing thing to hear. And you marathon walk now. Do you ever get any symptoms of angina?
No, I have not had any symptoms at all since the last time I had EECP, which was probably about
2005.
Yeah.
And so if heaven forbid you did have symptoms and you just go back and have the thing is there's no end to how many times you can have the treatment?
Well, there are some cost considerations, of course, but yeah, you can basically have as many times as you like.
Yeah, with my medical history, I would probably be approved by my insurance company
because
to have
it works.
again.
Yeah,
because it works. It definitely works.
And the treatment itself, you go in for a period of days over a period of weeks.
It's done as an outpatient, like a rehab program. So you come to the office, you put on bicycle pants to prevent friction in the skin, and you're on the machine for an hour, and you come every day. We skip the weekends. That's every day for about 7 weeks.
So 5 days a week, 7 weeks.
Right.
And at the end of that period...
Well, usually we start to see improvements by the 3rd week. The patients notice improved exercise tolerance, less use of nitroglycerin, less pain. And by the time we finish, many are happy with the procedure. It doesn't work in everybody. There are about 30% don't improve much. However, there's no harm in doing it. And don't forget, these are patients who have failed everything else.
That's amazing.
These are desperate patients.
It is totally non-invasive. I mean, you can
thing.
fall asleep on the table.
There's no cutting. What do you have to lose?
Right, and I think its simplicity is the obstacle to its use. Also, it's labor intensive. You need to have the equipment, the procedure.
We got to wrap it up right now, but I want folks to know they can go to our website, they can get your information and contact you. Dr. Tartaglia and Marie, thank you both for being with us. May you live to be 200, and may everybody find out who needs to find out about EECP. Sounds wonderful.
Thank you very
both
much
being
for
with us.
taking the time to have this.
Thank
you for being and sharing. We will be right back with some important information on a new list that defines what might be inappropriate medication for the elderly. Stay with us.